So let's talk about comas. So we're coming up on the 2-year mark from when I was first hospitalized for what turned out to be all kinds of different reasons. And if you know me and a little bit about my medical history and that kind of thing, you'll know that in 2016 I spent 6 months in the hospital in 4 medically induced comas. And so I've got some experience in what it's like being in a coma. And, you know, a lot of people ask me questions like, you know, what is it like? Do you remember anything? Did you dream? And it's not a quick answer, unfortunately. It's kind of like being in a, you know, that stage when you first start to doze off and you have weird dreams and you're still kind of aware of what's going on around you, but not really, because the stuff around you is making its way into your dream, but you're not really asleep and you're not really awake. That's kind of what it's like being in a coma, except that you can't wake up. It's definitely one of those things that, yes, and I'm only speaking from my experience. Every coma is different. Every person who is in a coma is in a coma for a different reason. So there will be different factors that will play into what that experience is like. But I can say from my experience, because they put me in a medically induced coma for several different reasons. They gave me drugs like fentanyl, Versed, and something else I don't remember off the top of my head, to put me out so that basically so I could be comfortable and unaware of what was going on while they were trying to fix me. The first coma they put me in was because my lungs were filling up and they needed to put me in the prone position. Again, some of this will be rehashed, but the first coma was supposed to be about 3 days after talking to the doctor and Rachel, and the three of us talked for quite a while, and we agreed, okay, we'll do this. We'll put me out, it'll be about 3 days, and we'll bring me out, and everything should go back to normal. Unfortunately, 3 days turned into about 3.5 weeks, and I was very confused when I woke up, but at some point, and I don't know when, I don't know. Obviously, when you're in a coma, the perception of time just goes out the window. You have no idea. So I don't know when I actually started having dreams, if you want to call them that, but I did, and it was, excuse me, it was very surreal. Again, it was kind of like being that weird half dream state. There were lots of times where reality, like what was actually going on in the real world, directly affected what I was experiencing in my coma / dream state. You know, there were a lot of boats. There were a lot of boats in my dreams, and I don't know why. I've never been a big avid boat person. I don't swim. You know, like I'm not a boat guy. But for some reason, boats played a big part of the dreams that I was having. The first coma I was in, I was convinced that I was in the bottom of a cruise liner being shipped to South America because the world's resources were running out, and there were a select few of us that were being transported to where the resources were. And of course, my dream, I get to be one of those lucky few. So that happened. And even coming out of the coma and being kind of aware of what was going on, the ICU room that I was in didn't have any windows. And I was that kind of led more in, or kind of contributed to that as well, where I really felt like I was in the underside of a ship. You know, I wasn't in in like a luxury cabin, like I was cargo basically. So, dang, excuse me. That was there we go. So that was a big part of the first part of the coma that I remember. There was more to it prior to that, but that was the first boat thing that happened to me. There was another time where I was on like a small yacht where somebody was throwing a big party. And that one went fairly well. Nothing real crazy happened there. There was another time I was on a luxury like super yacht, and everything was white and everything was very pristine. And I was arguing with some of the other people on board. And it turns out that that's one of the times where things really crossed over for me, because I was kind of in and out of the sedated coma state there for a while, and I couldn't really deal with reality. And so apparently I was arguing with the nursing staff, who were some of the other people on the boat, and I was arguing with them about wanting Blue Mountain Dew, and apparently I was being a real jerk about it, so they restrained me. But it happened both in the dream and in real life. I was actually physically restrained. They had me strapped down to the bed because apparently I was pulling at my cords and cables and stuff, and I was just being belligerent, which is, again, one of those unfortunate side effects of being in a coma, is dealing with reality can be very, very difficult mentally. And there were actually a few times that, because of the confusion that I was dealing with, that I had to be physically restrained to keep from hurting myself, hurting other people, ripping cords and wires out of me. It was a real bad situation. So there are definitely instances where, obviously, like I said, I dreamt a lot. I remember a lot of the dreams very, very vividly. I remember talking to Rachel and some of the nurses and doctors and the staff and whatnot about what was going on in my head versus what was really going on. And so there's definitely some crossover there. In 2016, there was a big attack in the Brussels subway system, if memory serves correctly, and they were just bringing me out of a coma when that was going on. And the nursing staff, for whatever reason, thought it would be a good idea to have the news playing in the background. And while it's usually good to have something playing in the background, catastrophic news isn't the thing for a coma patient to be listening to. When I woke up out of the coma, I was convinced that I was in Brussels, that I was trying to help people escape from the tunnels. I was mad at people around me because they weren't helping. So it was definitely one of those things where, like I've told a lot of other doctors and nurses and things who I've talked about this with, be aware, if you're in a room with somebody in a coma, be aware of what you're saying, be aware of what's playing on like the television or the radio or whatever. If they've got a favorite TV show or a favorite band or album or what, play that stuff. As much as possible, at a low listening level, because the things around them, even though the person in the coma can't respond or they can't let you know what's going on, they are aware, even on a subconscious level, they're aware of what's going on around them. And it's one of those things that I want to make sure that people are aware of, that, again, depending on the reason for the coma. If you've got a traumatic brain injury and your body just shuts down and goes into a coma, that may be very different than a medically induced coma like the fourth that I was in. But the answer is yes. If you're in a coma, like I said, a medically induced coma, chances are you will dream. Chances are that you will hear conversations going on around you. The television, the radio, the ambient noise around you will affect what's going on in your brain. And just one last thing that I kind of want to touch on here to keep this video from being too long is something called ICU delirium. And of course, ICU is for intensive care unit. But when you're in a coma, you don't get true REM sleep. Your brain doesn't ever really shut down. And basically you end up with, depending on the length of the coma, of course, like I said, my first coma was a little over 3 weeks. My second coma was a little over 2 weeks. My third coma was about a week. And my fourth coma was just a couple of days. But they happened all so quickly in the grand scheme of things. That all happened within the course of about 4 or 5 months. That my brain never really got a chance to reset. I, like I said, had a really bad case of ICU delirium each time, and each time it got progressively worse. There's a lot of confusion. It's sleep deprivation to the nth degree, and trying to process the time lost, trying to get your brain back on track to understand what's been happening is very difficult most of the time. When I came out of my first coma, I thought it was a different year. I thought we had a different president. I was very, very confused. And luckily, Rachel was there to kind of reassure me and explain to me what was going on and what had happened. And the fact that I'd been out for way more than the 3 days that I had been told or that we had planned on. It wasn't that the doctor had tricked me or anything like that. It was when they finally got me out, which I apparently fought considerably. But once they finally got me out, my body just shut down, and things went from bad to really, really worse. And I was hemorrhaging in my lungs, and my legs were clotting, and it was just a huge craptastrophe. But so ICU delirium is a real thing. It's terrifying for both the person having it, as well as any loved ones who happen to be there. Just because trying to distinguish what's real and what's not or it can be very, very hard, especially after multiple lengthy comas. After my third coma, I think it was my third coma, I was convinced that I was dead. I actually really thought I was dead and that this was the afterlife, and that and I couldn't trust anybody. I didn't trust the doctors. I didn't trust the nurses. I wouldn't talk to anybody. They did all kinds of crazy things to try to get me to respond. For instance, it's common practice in the medical field, if you've got somebody who you think is trying to fake non-responsiveness and things like that, doing a sternum rub, which is where you take your knuckles and you dig into that bone right in the middle of the chest, and you just rub up and down as hard as you possibly can. It will get somebody's attention. It hurts. It's really, really unpleasant. And one of the nurses at one point did that to me, and I was awake, my eyes were open, I saw him do it, but I was so disconnected from reality. I didn't even blink. It was a nothing thing. I had like basically completely separated my brain and my body, and I was basically watching it in a first-person view happen to someone else. It was a real weird situation. Rachel was an EMT, and she's like, well, maybe you just didn't do it hard enough. So she did it, and again, I watched, completely disassociated from it. And at that point, she knew that there was something really, really screwed up in my head. The doctor or the nurse, whoever it was that was with her when that was going on, was stunned, and actually the words, "Give him a purple nurple," came out of his mouth, and they did. And again, completely disassociated from the entire situation. I watched it happen, but I didn't feel it. But as soon as the nurse left, I started talking to Rachel again, which of course drove her crazy because she hadn't slept much, so she thought she was going crazy. It was a crap situation for everybody involved. So that's where I'm going to kind of wrap it up right now. It's a little longer, we're at like 15 minutes here. It's a little longer than I wanted this video to be, but there's a lot of stuff to cover. If you've got specific questions, I would love to answer those. Get in touch with me via any of the comment section down below, or if you got me on social media, if you've got my, however you want to get in touch with me, all that stuff will be in the description down below as well. Get in touch, leave a comment, whatever. Ask me any questions you want about my medical stuff, about comas, about any of that. You know, I went through all kinds of different medical procedures last year that I can talk about, and I would be more than happy to talk about any of that. So if you've got any of those questions, hit it up in the comments below, or get in touch with me on social media, and we'll just go from there. Anyway, thanks so much for watching. I'm sorry this took so long to get out. It's just a very complicated topic to talk about. And try to be cohesive about. I'm sure this video isn't even close to cohesive, but yeah, anyway, again, thanks for watching. I always appreciate your support, and I'll talk to you in the next one.